Alright, now this is going to be the second part of the assignment. We're going to move on to the patient application, and this is where you'll use your case study. Now, I'm going to give you an example. I'm going to go over case number 1 as far as the information that you're going to extract from this. So, case number 1, you have John Abrara. His chief complaint, and excuse the typo because chief is spelled wrong. His chief complaint is tightness in the chest, shortness of breath, and fast heart rate. The history of present illness, which is also noted as HPI. He is a 42-year-old gentleman from Bangladesh who presents with chest tightness, shortness of breath, and a fast heart rate. Dr. Cecil Burnett, cardiologist, is evaluating his heart condition. The patient had the recent onset of hemoptysis. He was treated for tuberculosis in Bangladesh 15 years ago. This has prompted the concern of whether his treatment for tuberculosis was adequate or whether there is another cause for his hemoptysis. The duration of his tuberculosis treatment was adequate according to his wife, but no records are available. In addition, the patient had thrombosis of the axillary artery treated last year at Hillcrest. He had an embolectomy and has been on Coumadin since. INR is significantly elevated at 16. His past medical history is tuberculosis in the past, embolectomy at Hillcrest last year. Patient does not smoke, drink, or participate in illegal drugs. Social history. Married with 2 daughters. He's been in the United States for 10 years. Patient has no recent history of smoking. He smoked in the past, but the amount is unclear. He is a restaurant manager for the Marriott hotel chain. Family history. No known family history of diabetes, heart disease, or cancer. His mother died of a stroke and his father was killed in a motor vehicle accident in Bangladesh. The review of systems. Now, the review of systems on the case study is what was actually performed on him. When you go to the review of systems on the application, which is right here, this is what the patient has had a past of. So do not get that confused. So I went over all of that to give you an overview on what you're going to fill out today on this application when you're evaluating the case study. If there isn't something in the case study, you do not have to make it up. And if I haven't given you an example of it, such as the demographic samples, the date of birth, social security number, Texas driver's license, sample address, these things like this, then you don't have to worry about making it up because a lot of times patients leave that information blank anyway. But I don't want you to have to go and stress yourself out, say, oh, it's not here, we have to fill everything out. No, that's not the case. So we're going to skip down to where it says personal information. If we're doing case number 1, you know that's a male. First and last name, middle if they have one. You don't have to worry about the suffix. Date of birth, again, we're going to use today's date, and you'll use their age to create their date of birth or the year that they were born. Please denote the sex, the social security number that I gave you to use. If you know their primary language, you may mark it. Use the Texas driver's license number. You do not have to denote their blood type. If their race is available, you may mark it. Marital status, mark it. Eye color, hair color, you do not have to worry about that because this is a case study, so it doesn't give you that information. The sample address is what I want you to put here. For right now, I'm not really too concerned about a phone number, so you don't have to put that in there. Emergency contact, you can make up a spouse's name. I'm fine with that. Employment information, You may not have the address. You could just put what they do. The unwanted condition of why you are here today, that is the chief complaint. That is where you would put that information. When did this condition begin? You could put years ago. You could put 2 weeks ago. You could put the date if it's listed. Has it occurred before? Yes. And all of your conditions are going to be denoted as other. And explain. If the patient has a story, explain it. You will not have to worry about the date of accident, time of accident, because none of these are accidents. And if the case study gives you descriptions as to what they're feeling and where it's located, you will mark it here on the body on the right. Now, the review of systems, again, do not get confused by what actually the patient had performed as opposed to their past medical history. So, where it says, I deny having or have had any of these symptoms or problems, when you say you deny, you would leave it blank. So, in this case, Mr. Barra doesn't have anything constitutional. He doesn't have anything wrong with his eyes or vision. But if we come down to cardiovascular and respiration, you would circle shortness of breath because he can't deny having that. And you would also circle angina, chest pain, or discomfort because, again, he cannot deny that. Under cardiovascular, you have chest pain and you also have shortness of breath again. So it's going to take you a little time to go through these and read them to make sure that you're not leaving anything out. What I also want to point out to you is that if there is something that is not on the application, you are free to add it. So let's say here, I just went down a little bit to where we have adult illnesses, childhood illnesses. I'm going to go back up and explain this in a minute. But you have your adult illnesses. Well, I don't see tuberculosis on here, so you want to add that here under other. I also don't see embolectomy. That's a surgery. So you want to put that here under other. Again, this is just me giving you an example of the first case study so you'll know how to do your own. And then I'm going to go back up here. So you do have to go through each system to, again, make sure that you're not missing anything. And yes, it does take our patients about 30 minutes to complete these applications, especially if they read it thoroughly. If you've been seen by another doctor for this condition, yes. If so, explain the treatment. You can disregard the previous chiropractic care because this is not a chiropractic patient. Here, you would list the current medications. If the dosages are not there, you don't have to worry about it. But I would suggest that if you don't know what the medication is for, that you look it up and find it out. Because patients are going to come into the office with medication that you've never heard of before. Or they'll have different reasons why they use certain medications that are not common. If they have vitamins or herbs, you want to make sure that they document that. Or that you document that. I've already explained this. Surgeries, females. This needs to be completed if the information is available. If it's not, don't stress yourself. You may skip over that. If they've mentioned any injuries, you want to make sure you circle that. Any immunizations, if they've listed that. Any allergies, non-drug allergies, and the family history. Mr. Barra said that his father was killed in a motor vehicle accident, so you would circle deceased. And I believe his mother had a stroke. and you can put had a stroke. And if he doesn't have, and he does have daughters, and as far as you know, they're alive. He did mention his social history. Alcohol, he doesn't drink. He didn't say too much about his dietary intake. He didn't say anything about his education, but he did say that he never used illegal drugs. So you would mark those things. And why did that do that in the middle of me talking? All right, let's go back down. Go back. And it is important that you go back because although he may not smoke now, he quit smoking. So you need to make sure you denote that, especially because of his current condition. Now, the insurance information, you are all going to have United Healthcare from the demographic sample that I gave you. And it's going to ask you the healthcare insurance carrier, that is United Healthcare. The policyholder's name would be the patient. The social security number will be the sample that I gave you. The health ID card number, the group number, and the primary care physician if it's listed. You will not have to worry about writing out this information, workers' comp, because it's not a work injury, it's not a car accident, but you will need to read the patient statement. Sign, and you have all read the notice of privacy practices for protected health information. So again, it should take you a little while, maybe not 30 minutes to go through the application, but it is sometimes a tedious process because you do have to read. And yes, the reason why I want you to do this is because as a billing and coding specialist, you will have patients that are going to come up to the window and ask, how do I fill this out? What are you asking me? I don't understand what this means. And yes, some of your case studies are laced with a lot of those medical terms that you didn't know from before. So it's important that you keep up with those terms. And that's also why I've allowed you to use your Chromebook so you can look up medications, so you know what they do, and so you can look up the conditions and understand what they mean. If you'd like to swap cases so you can practice, that's fine too. I would highly actually recommend it because it gets you looking at different conditions and different situations. I more than likely will be up during your class period, so if you have questions and you get confused, I will be by my email. You guys can email me and I will assist you if you have any questions. So, y'all let me know and y'all have a good day.